Good morning. This is Sheila Howe, Director of Oncology and the Breast Center at Ascension St. Vincent. And today we're going to take a tour through Ascension St. Vincent Evansville Cancer Center. Of course, we have our screening for our COVID screening. And what you're looking at here is our radiation therapy check-in front desk. We're going to spend the first little bit this morning going through a tour from Terry Wade, our Manager of Radiation Oncology.
Terry. Hi, I'm Terry, and I am going to take you first into our SIM CT room. This is where the treatment planning process takes place. So we're going to go right over here. And then each patient, before we can start radiation, needs to come in here. We make whatever type of devices that need to help them feel comfortable or be comfortable while they're going to have their treatment in their treatment planning process. We line them, straighten them up, and then we do a CT scan of the area that we're going to treat. And then once we come out for the last time, we have these lasers that are coming out of this bridge, and we also mark that on the skin or on the treatment device that we use. These images that we acquire from the CT SIM, they are pushed into our treatment planning computer, and there where the dosimetrist along with the physician does the planning for the treatments. We are at one of our radiation treatment machines here. It's a Varian, and on here we treat the majority of our breast patients. And this is the outside control area. We have 2 cameras that we can watch the patient. We also have audio video that the patient can talk to us, and we can talk back to them and stop the machine if we need to. So we're going to go ahead and go inside the room now. Excuse us, this is Phil, one of our radiation therapists. And then here is one of our treatment machines. We actually have the breast board down on the table now because our next patient we're treating a breast. We'll put her in position and raise her up and then line her up to her marks and her laser marks that we put on in the SIM room. And so this is the treatment room then.
I was going to have our infusion center manager talk with you, Stephanie. However, she's in a meeting about our updates for ARIA for our new computer system. So I'm just going to take you on a short tour. This is the small area here after the patients come in and check in, where our infusion center patients wait before they're called back to our center. We only allow 1 staff member since COVID has come to sit with our patients, and they have to be screened and obviously wear a mask. If you walk just this way, we'll walk through the double doors, and we treat probably somewhere around maybe 65 patients a day sometimes in our infusion center. This is our center, and if you kind of pan around, we have individual patient stations throughout the center, and we also have a wide variety of private rooms. If you look back there, you can see, if we walk back here a bit, our pharmacy is just behind this wall, and all our medications are mixed the morning of treatment, and they come through the sealed door here through our machine to the nurses area. But that's our pharmacy station back there. And you can see the pharmacist already working and seeing what the day is going to be like and start preparing medications whose patients' labs have already been checked and approved. And if you just kind of walk around the area, there's a nice bay windows here, nice area where you can see the landscape. And outside, just across the street, we have our urgent care setting and our breast center. And then if you look outside, In the other direction, we have our orthopedic hospital. This now is turned into probably a big medical complex intersection. Across the street, our partners, Digestive Care, they're an independent digestive care group. They will build a new building there. Currently, they're in one of our office buildings, so we'll have a lot of space vacated when they move. But each station is fully equipped with lounge chairs, and then if the patient isn't feeling well, we'll just walk over here and we'll just show you one of our private rooms. Sometimes patients have longer infusions and want a bed, and sometimes people just would rather lay down. So there's several other private rooms along that side of the hall, and this private room here, and so you can see from this room here that the patient is clearly visible through a half wall right here. And then we've got a privacy curtain. These rooms are also equipped with a television and a whiteboard and a restroom. Otherwise, the patients, if they're here for shorter infusions, we have other restrooms located around the facility. We're going to now walk through the other doors, and I'll show you our physician office suites. And so the physicians, medical oncologists, see patients then in the exam rooms very close to everyone here. So this is one of our exam rooms, and it looks like any exam room. And our medical oncologists then share these exam rooms up and down the hall. We have 2 procedure rooms as well. We have a lab, and we'll kind of walk and we'll find the lab. That's where people check out. If once they're medical oncology, they're done with their appointment. We have our checkout folks right here, and they check out and make their next appointment, get all their labs for the next time, and then they exit through the door right there back into the waiting area. So we'll just take a short walk here down to the lab. This is our lab area. Say hi, girls.
Hi. Yeah,
So we have our own lab and our own lab stations here.
Oh.
And the patients, once they check in, before they see the physician or before they get their treatments, they come to the lab, and all the lab work is drawn here, and it's passed through our lab station that runs all the CBCs and comprehensive metabolic profiles, anything else that we need. This is the area when patients, again, what you see there is the front door. When people walk in the front door, they have 2 options, either to go over to the radiation therapy side where we do our radiation therapy treatments, or if they have a medical oncology appointment or infusion appointment, this is the area where they wait in, and then they go back to the small infusion center waiting room hall. The building has to have a wall between it because of billing, and because the infusion center and radiation therapy are hospital departments. So a wall had to be constructed when we bought the practice, and kind of, well, it kind of ruined the ambiance for the whole great room that was very, very pretty before a wall was put in. So this is our cancer center, and this concludes our tour, and thank you very much.